Hello, this is Dr. Dave Yachter. Thanks for joining me today. We have the condition of the week that we're bringing you, and we're going to be discussing acute otitis media, better known as ear infections. And we know that ear infections can occur in children as well as adults. So in this episode, we're going to talk about the most critical factors when it comes to understanding and avoiding this uncomfortable and sometimes dangerous condition. And the reason why this is important is because acute otitis media is the most common cause of pediatric office visits in the United States. It's one of the most common diseases of childhood, and it's been estimated to cost the United States more than $3 billion annually. Every year, an estimated 700 million episodes of acute otitis media occur globally, half of which are in children under 5 years of age. And by the age of 3, at least 80% of children are expected to have at least one episode. This makes ear infections the most common pediatric infectious disease and the most common reason for medical visits, antibiotics, prescriptions, and hearing impairment in children. So, as many of us know, an ear infection is an infection of the middle ear, and children are more likely than adults to get ear infections. Because ear infections often clear up on their own, treatment may begin with managing pain and monitoring the problem. And some people, more than others, are more prone to having multiple ear infections. And this can often lead to hearing problems, hearing loss, and other serious complications. The signs and symptoms of an ear infection can come on pretty rapidly. It's usually found with ear pain, especially when lying down, that makes it worse. Tugging or pulling on an ear, trouble sleeping with children, obviously crying more than usual, fussiness, trouble hearing or responding to sounds, loss of balance, fever, headache, and of course, drainage of fluid from the ear. So what causes an ear infection? Well, it's if you look it up online or you talk to a doctor, or most people believe that it's caused by a bacteria or a virus in the middle ear. But if you've learned anything in our office, you have learned and hopefully understand by now that bacteria nor viruses are the cause of disease. And Virchow once said that it's not the seed, it's the soil. And just like in the same instance with the pandemic that we're in right now, many people get sick from COVID-19 and they become infected and have symptoms, and many others are exposed to the virus and do not exhibit symptoms and they don't get sick. And therein lies the reason that it's not the bacteria or the virus, it's the host. And so if you have a healthy host, bacteria and viruses can do no harm because there's no opportunity for them to camp out in that host and create an infection and feed on dead, dying flesh or cells. And that is the case with an ear infection or anything else in the body. But in the case of an ear infection, it usually occurs when the resistance of that individual goes down and their immune system is weak. And of course, if there is an exposure to bacteria, viruses, or there is an opportunity for that opportunistic vector to set up camp in the inner or middle ear, then there's an opportunity for an infection to develop possibly. So always understand that it's not like we are weak and hopeless and helpless when it comes to germs, bacteria, viruses. It's not like they just jump down our throat or pry into our ear and set up an infection at their will, and we have no say in the matter. That is never, ever, ever the case. So that's why we're always proactive, and we're always here educating you on what to do to make your body healthier day by day with all these different things that have to do with your lifestyle. And it's not just you, it's your family as well. And the best time to start working on an individual's health is as early as possible, especially when it comes to kids. So, bacteria, viruses are part of the equation, but they don't have preeminence in terms of whether or not a person gets sick. That all has to do with the host, how healthy or how sick they already are, how strong or weak the immune system and the resistance is. So that's what leads to the ear infection. When an individual does have an ear infection, the typical costs for non-hospitalization treatments usually ranges on average about $300 when somebody has to go under antibiotic therapy. And usually there are multiple prescriptions that have to be administered. There may be one scenario where you have to take a prescription, it kills off the bacteria, but then again, it weakens the immune system and increases the risk of reinfection, where more time and more money has to be allocated to the issue. Not to mention parents losing time from work for doctor's visits and dealing with this. Hospitalizations, if it comes to that, an average cost of a hospitalization for acute otitis media or an ear infection is approximately $1,800 per episode. And in the extreme cases where ear tube surgery has to be administered, that typical cost can range anywhere between $2,000 and $5,000. And that's in addition to all the other costs leading up to it. So, you know, it can be very frustrating if you're a parent, you've ever had a child with an ear infection, or an adult for that matter, because usually the first course of care is antibiotics. And the Journal of the American Medical Association published out many, many years ago showing that never, ever, ever give antibiotics for an ear infection because it significantly increases the rate of reinfection. Because again, if the cause of the infection is a weak immune system to begin with, and you take antibiotics, what do antibiotics do to an already weakened immune system? That's right, make it weaker. So of course, this is a source of frustration as parents historically find themselves having to deal with this over and over and over and over again because nobody's typically getting to the cause, the source, and the roots of the issue. Even the American Academy of Pediatrics, their guidelines recently supported watchful waiting, in which there's an observation period of 2 to 3 days before antibiotic initiation to permit spontaneous resolution of symptoms. I like that. Spontaneous resolution would be another way of saying the power that made the body heals the body. So I want to talk to you about another cause for ear infection, really a cause that would weaken the immune system and give an opportunity for bacteria or virus to cause an ear infection. That's something called subluxation. A recent study that was done, an osteopathic study, randomly examined 100 newborns for trauma during childbirth. And they randomly examined them anywhere between 6 hours and 72 hours after birth. They wanted to see what would happen after evaluating children just through what's called a natural childbirth or a childbirth in a hospital. And basically, we know what happens in those scenarios. A woman is lying on her back, pushing up against gravity. So of course, the doctor has to use hands, vacuum extractor, forceps to pull the baby out and use a lot of force. And there's typically damage that occurs to the cervical spine. And people had suspected this, doctors had suspected this, researchers had suspected this, so they set up this study to find out really what was happening. And what they found was 99% of all of the newborns that were evaluated post-birth, what they found was 99% of them had trauma to the cervical spine, a sprained strain, which is the equivalent of a whiplash. And this was in 99% of them. What they also found was a baby is supposed to have a curve in the neck when it's born. And what do you suppose happens when you take a baby by the head and pull it out? It takes the curve out of the neck. And when it does that, it stretches the cervical spine, it stretches the spinal cord, and it actually sucks the brainstem into the bony canal, puts pressure on the brainstem. And research has indicated this in previous studies that the brainstem being affected at childbirth affects the immune system. Just like Christopher Reeves many years ago, the actor that played Superman, when he flipped off the horse he broke that top bone in his neck, sent it jamming into his brainstem. And everybody knows that he was paralyzed, never walked again. He was on a respirator, but very few people, put two and two together and see what he died from. And that was from chronic upper respiratory infections. Because of the damage to his brainstem, the pressure on his brainstem, it weakened his immune system to the point where he actually died from chronic upper respiratory infections. His immune system was bottomed out since that trauma occurred. Now, what I'm saying is the same thing in many cases happens during childbirth, immediately causing subluxation, the top bone shifting out of alignment, putting pressure on the brainstem, weakening the immune system of that infant. And if you continue to have that immune system continue to run down as that child develops, they are prone to developing immune system problems, ear infections, asthma, allergies, all types of upper respiratory infections. And one of the causative factors most commonly has been linked to the birth process where subluxation is caused. And many parents bring their children in to the office to seek an alternative to medical care and antibiotics. And that's the first thing that I evaluate them for. The top bone being out of alignment in the neck. And what do I find? In 100% of the cases, it's always present. I've never found a child who has ear infections to come into the office, be evaluated, and not have pressure on the brainstem due to subluxation. And so it's my job to correct that and remove the interference and allow the body to heal itself. And guess what happens when we do that? Of course, the body gets stronger, and there's no way that somebody cannot be better off. Any child, man, woman, there's no way that a person cannot be healthier with a healthier nervous system, because the nervous system is what controls the immune system. So let me read to you this testimonial from a mother who obviously was very pleased with the outcome of taking care of her child. She said, before receiving chiropractic care, my daughter had ear infections at least 1 to 2 times a month. She would not sleep and would scream all day and night. The feelings I had about chiropractic care, she says, was disbelief. I didn't believe that pains could be cured without medicine. She said, however, I felt I had nothing to lose. The medicines that I was giving to my daughter were obviously not working. We must have tried 3 or 4 different kinds. So she says, now, since my daughter has received chiropractic care, she has not had 1 ear infection. I can now sleep peacefully, and so can she. She says, please try chiropractic care. Do it for your children, if not for yourself. The results are phenomenal, and your kids will thank you for not damaging their bodies. She says, say no to medicine and yes to chiropractic. And Keandra wrote that a few years back. So that's just one example. And I've had countless hundreds of children that I've taken care of over the years in practice. And I can tell you that the greatest thing about adjusting children and taking care of children is that their problems haven't been there very long. And usually they respond very quickly. And from there, you can prevent serious problems. If you can prevent them from multiple rounds of antibiotics, which not only damage their immune system, causing short-term health problems, but also setting them up for long-term chronic illness, including chronic colds, flus, cancer. That's what antibiotics are linked to, have an association with long-term chronic health problems. If you could save them from tubes in their ears, permanent hearing loss, permanent damage, I can't tell you how many people that I've run into that have to live with that for the rest of their lives. So just remember, by 3 years of age, at least 80% of children are expected to have at least 1 episode. That's 4 out of 5 children that you and I know that parents are taking care of are going to run into this, or they have dealt with this, or they could be dealing with this right now. So the question is, who do you know that's suffering with this? If you know someone, say something. I urge you, I beg you, I plead with you, say something, because you can make a difference in their lives. Please let us know if there's anyone that you know that's dealing with this, if there's anything that we can do to help. That's what we're here to do. Leave our community in better shape than we found it. That's our mission. And I thank you for being part of our family. Thank you for joining me today. I love and appreciate you. God bless.